mean, I figure we'll make this short and sweet and
Sure.
impactful. So
Yeah.
let's start with you just telling us a little bit about yourself, and then we'll take it from there.
Sure. So I'm Anya. I'm a pediatric sleep medicine physician and respirologist, which basically means I help kids to breathe when they're sleeping, when they're awake, while they're active, while they're at rest. I'm originally Jamaican, so I lived in Jamaica for the first 18 years of my life, and moved to Canada to complete tertiary education. I ended up in going to med school and, did basically all my training here in Toronto. Currently, I am an assistant professor at a tertiary care center and university here in Ontario, where I have a practice that entails or involves seeing kids who have sleep-related breathing issues, but any other type of breathing issue as well. I live in a place called Oakville with my husband, and I have two boys. One is 4 and the other is 1.
Oh, bless your heart. Bless your heart. Well, it's so good to have you. So first question is, why sleep? What prompted you to pursue a career in sleep medicine? So we have tons of stuff in common, which is always so exciting. And that's why I was just so eager to get to chat with you. I know we've had a lot of conversations offline, and we share so many interests. And so I think this is so much needed. I'm really excited. So why sleep medicine?
So when I went into respirology, and I first was introduced to sleep, I think initially what pulled me in was being curious and intrigued about the field. I think that we've made a lot of progress in sleep medicine in the last decade or even 20 years, but I think there's still a lot to be done. So if you were to compare the field of sleep medicine in children to the field of sleep medicine in adults, like we're still many years behind. And so it was originally just an intrigue, and then as I started to work with patients with sleep issues and see how impactful being able to help them breathe was for just their overall quality of life and other markers of wellness, I think that's what sort of, that's where my passion really grew. And so yeah, flash forward. I finished my training in 2017, and I can't imagine doing anything else.
Oh, that is awesome. You just really are helping the kids sleep better and breathe better. That is beautiful. So what is the sleep gap? That was one thing that, I know you started this work, and it really got me thinking. Yes, there is, like you said, even when it comes to just that discrepancy between sleep health in adults and in children. Really, most people tend to focus more on, okay, my baby's not sleeping, and it's almost as if nothing after that first rough year of life. After that, it's like, nothing else goes on, fingers crossed.
Yeah, yeah.
so, so,
You
so
know,
really, what is the sleep gap from your perspective?
Sure. So I think, once I came out of fellowship and I started to see patients and have to manage their sleep issues, a lot of the referrals, my primary area of sort of focus where pertains to sleep is managing sleep-related breathing issues. But
Mm,
but quite often, many of the referrals that we get are related to sleep-related behavioral issues. And I remember initially feeling a bit, because in honesty, our respirology or actually sleep medicine training focuses a lot on the sleep related breathing component of things, and
mm,
the sleep related behavioral thing is sort of a tack on or a on the side type deal. And so I remember going through sleep training, not being as sort of motivated at that time to learn more. But once I got into training and realized, how prevalent sleep-related issues are in children, I really, was moved to try to understand and learn more. But I think what grew out of that was also just, it started as a thought, what if most of the referrals and most of the issues that we're being asked to sort of see and treat could be addressed, at least we could start to address them in the primary care setting. Many physicians that I've come across, and even other primary care providers, feel very uncomfortable managing sleep issues. And so the sleep gap really describes the disconnect between sleep issues, whether that be sleep-related breathing issues or sleep-related behavioral issues, and the ability of care providers to accurately sort of screen and manage those issues, but more importantly, for parents to actually recognize when there is an issue. And so, like, for example, quite often when I do my histories on patients and ask if there's any parent that snores, I mean, I would say that 80% of the time there is, but it's not thought of as a big issue or concern, because it's thought to be, well, everyone in the family does it. And so, given that there's so much related to the adverse events of poor quality sleep and insufficient sleep, I mean, it has so many implications on different sort of markers of child health and wellness. I felt very moved to see, is there a solution? Like, are we doing the best job that we can as pediatricians to, to ensure that our kids are having optimal sleep health? And so that's sort of what the sleep gap is trying to do, to bridge that disconnect between sleep issues and the ability to actually recognize and manage them.
I love that. So essentially, we know sleep is important, right? If you've walked on the earth for a day or two, that lack of sleep does have impact. I mean, to what extent, that's what we're here for, right? As sleep providers, to educate the community and things like that. So now you come up with all this knowledge. You figured out, yes, I understand sleep is important. Then it translates to, okay, then how do I get enough of it? How do I make sure I'm getting good quality? And then for me, I see that disconnect, which is where, your program really perfectly fits in. It's like we're going from just saying, yes, make sure your child gets 9 to 11 hours of sleep if they're school age or whatever it is, and good luck, see you later. Or you come into your, as a pediatrician, you're seeing your patients, they have like so many other things going on, right? You're thinking of their growth and development, you're thinking of their weight, they're dealing with, sometimes food insecurity, so many things that sleep as a question may just come up and say, okay, are you getting enough sleep, or is there any sleep problem or something? And unless you unless the provider, the clinician remembers or is prompted to ask that question, you will most of the time not even get that information from the parent, because sometimes they have so many other things that they're trying to balance. And sometimes this is their fourth kid, and none of her kids slept well as a mom. So she's like, well, I guess this is what it's meant to be. But until as a physician, as a clinician, as a provider is prompted to ask those questions, we will not know what we don't know. So I love that you're helping to really bridge that gap between there's the knowledge of it, but how do we bring it into, even primary care, where I work, one of my colleagues really talks about having sleep as a vital sign, like almost the same way you're making sure the person has good, normal blood pressure, has all sorts of things to ensure that we are dealing with the sleep issues. Because the other piece, and I would definitely love to hear your input on this, especially compared to what I experience, is a lot of these kids come in, they're hyperactive, they're exhausted. I see a question about, can lack of sleep in kids cause of the behavior in school, which is a perfect segue to what I was going to talk about, where they are bouncing off the walls. They are just having a hard time settling down. They're impulsive. They're just really having a hard time emotionally self-regulating. And sometimes, I'll dare say, a lot of the time, all those things are consequences of poor sleep. And so instead of routing them to that area, sometimes then we start focusing more on, oh yes, could this be ADHD? Could this be another completely different disorder? And so it's incredible how that there's just that discrepancy. Like, the fundamentals have not really been, addressed. And I would love to hear what your experience has been, just in terms of just how this really presents, even in your practice or in those that are
Yeah.
referred to you.
Yeah, I mean, I would say definitely we do have, a lot of referrals for children who, have features of ADHD. So, they're
Mm,
impulsive, they're inattentive, they're labeled or described as
mm,
oppositional or being the
mm,
troublemakers in the class or just not being able to sit still. And I mean, luckily, definitely there are primary care providers that recognize that, sleep or having a sleep study would be an important step in working that patient up. And so I definitely do see those types of presentations. But I often, in any patient that I see, I will screen for sleep. And oftentimes, when I do delve into sleep and start to talk about, different markers of sleep quality and sleep duration, I would say that most times parents just aren't aware. Like, they aren't aware about, like, that different things could be markers of poor sleep. And I think, within, having a gap in pediatrics is just the surface level. But, as within pediatrics, there are different populations of kids. And so, there's data to show that kids, for example, who are of racial and ethnic minorities have poorer sleep quality than non-minorities. There are kids with chronic disease. So there was a study last year looking at cystic fibrosis and the sleep quality, kids with cystic fibrosis, picking up that, their sleep quality is quite poor, but also experimenting on sort of easy strategies to actually address and improve it. Kids with sickle cell disease, for example, have increased periodic limb movement disorders and restless leg syndrome, which is usually a treatable condition that can significantly improve sleep quality. So I think that, the presentations may sometimes be very obvious, and can definitely be recognized by primary care providers. But in most cases, it's I think that we're not really getting to the deep core of the sleep epidemic. And it really is an epidemic, right? Because
mm-hmm.
even like looking even in adults, like, there's an estimate that at least 1 in 3 adults are getting less than the recommended number of hours of sleep, right? And estimate that in pediatrics that up to 50% of adolescents, for example, are not getting enough sleep or good quality sleep. And in children, that number ranges between 25 to 40%. So even with those numbers being as high as they are, I still think that we're probably not getting to we're underestimating that. And I mean, to put those numbers into practical sense, in Canada, for example, the population of kids approaches about 7 million. Right. So even if you take the lowest number of 25%,
Mm-hmm.
that's millions of children,
Yeah.
millions of children who, are not getting good quality sleep or sufficient sleep and actually suffering the consequences and sequelae, which are numerous. And, that's a whole nother topic. But, I think that it's a call to action. I think that it's an area that is very easy to actually screen. And, there have been a few studies looking at the lack of actual sleep respirologists available and sleep specialists available compared to sort of the sleep issues that exist. So if we can arm our primary care providers and arm our parents as well with the tools that they need to recognize a problem and for the care providers to actually action, then I think that it will significantly impact the current poor sleep health epidemic that we're seeing.
Absolutely. There's so many places I want to take this, but I'm going to really try to focus. One of the things you talked about was, just the sleep health disparities, which is huge. In fact, there was a study that came out literally maybe last week or so that talked about the fact that minority college students actually
Yes,
have
I saw that one, yeah.
significantly poorer academic performance because of sleep deprivation. So the consequences of sleep deprivation on even that group is much larger. And really that brings us to that access, like people have asked me, wait, what? There's pediatric sleep medicine. Like, what do you do? You know, and just hearing those numbers are staggering. Up to 40% of children have sleep disorders, and
Yeah.
so many of them go undiagnosed or diagnosed wrongly, either because, you know, the right questions are not asked, not by fault of anyone. I mean, if you think about even your primary care visits, you know, at least even me personally, or for my kids, sometimes it's like this short 30-minute window that you have to get it all out
Yeah,
there. And so really depending on what's really on the forefront of your mind, it drives how the direction of the conversation goes. And
definitely.
sometimes even for providers, as medical providers, as pediatricians, sometimes just the time constraints really doesn't
Right.
afford them the opportunity. And then on top of that also, there is access. So I think that's where the other piece that I really wanted us to highlight a little bit, like how do we navigate that? How do we navigate access issues, and how is that impacting the ability for us to get good sleep care to our children?
Yeah, no, I mean, I think that you know, there are a few pillars that, you know, being able to access and provide care sort of rest on. You know, I think there's still an under recognition of the importance of
Mm,
sleep. And I think that's sort of where it has to start. You know, I think you know, even in adult sleep, which we know is linked very strongly to so many sort of adverse health outcomes, there's not that awareness. And so I think an awareness and a recognition and a decision to make it a priority is sort of where it has
mm,
to start. And I think that once we're at that stage, being able to first educate and arm ourselves from a primary care provider perspective with that knowledge and very quick and simple tools. I mean, you know, there are simple questions that you can ask and screen sort of, you know, within an encounter for, you know, if a primary care provider sees a child every year, for example, you know, screening for sleep should be, and definitely, you know, the standardized screening forms for overall health for well child visits in the first 5 years of life do have sleep, you know, as a question as to sort of whether it encompasses all the aspects that we should look at is another issue. But I think, you know, having screening questions every year when a child comes in for their well child visit would be one place to start. And so, you know, I mean, I think maybe it might take up a few extra minutes, but I think, you know, I always, and whenever I explain different decisions to my patients, I always talk about the cost benefit ratio. And so the benefit of actually detecting and being able to treat or manage a sleep-related issue or condition for a child, I mean, it way outweighs the cost of an extra few
mm,
minutes, right? And so I think starting to being aware, recognizing, and deciding to prioritize sleep health in every encounter once a year, for example, with a child is where you start. And the second part is just educating yourself. I mean, a lot of times as well, it's possible that primary care providers may not feel comfortable delving into sleep because when the sleep issues are listed by parents, you know, they might feel uncomfortable not knowing where to take that and what to action next. And so education is another key component. You know, there's a study that was that I reviewed that said in medical school, and this was out of the States because we don't have such studies in Canada, but in medical school, the actual time that's spent on sleep education is less than 2 hours in the entire 4-year curriculum, which is appalling. And the majority of that time is spent on adult sleep and not on sleeping children. And so, I mean, we have to start from from the basics, you know, from medical school when we get exposed to different, you know, areas of health, like that needs to be a priority. But it extends into any residency program training that follows, you know, family medicine, you know, pediatrics as well. So I think those are places to start. And I think in terms
yeah.
of, you know, access, I think once we're more aware of the health inequities and the sleep inequities that exist, it will close into to really sort of tracking and monitoring that when we, do see a patient who comes in that fits into that demographic, for example. And so I think, recognition, awareness, prioritizing, and then educating are like the pillars of where to start.
That's incredible. Again, I feel like each and every one of this is like a live on its own. And thank you so much, Rachel. I am Christine. We will definitely look at that's a great one to improve your son's attention span. Optimizing the sleep is an excellent place to start. Like making sure that's definitely a foundation that you then build on, and it's not as if we're saying like, oh yes, fix sleep and then you fix all of life's problems. But
Right.
it's a critical pillar. And so, just in a way of tying this together, and it's so funny you mentioned that the 2 hours. I can tell you that when I was growing up, like in fact, after a while, sleep was almost like, wait, what? Why would you waste your time sleeping, right? So there's even that narrative. And then if I got into trouble, I was sent to my room to sleep. So I had a negative, had a negative association with sleep, and now I've come to love sleep, right? Because we're not really taught. There's not necessarily a curriculum in medical school. And interestingly, I don't know how it is with my certification, my sleep certification. I think I'm like number 200 and something, to show you how few people there are in our field. So it's a small field for something that's so critical, and there's just not enough of us. So what you're doing with the sleep gap, I think, is phenomenal, because essentially what you're doing is taking that knowledge, that commitment you made to be a leader in this field, and then dispersing it out to the community, such that people don't have to wait 8 months to see you, which is my wait time right now. You know what I mean? Such that people don't have to struggle for months and months before they come to see you. There's some basic things that we can empower our families with, so that they can advocate for their children. And then there's stuff that we can empower our pediatricians, our family physicians, our nurse practitioners with, such that they know what to look out for. They know the trigger questions that would then prompt them to make the right decisions. So maybe what we can do to just kind of tie this together, and then you tell us a little bit about what you've been up to and all the good stuff that's coming down the pike, is what are some just like takeaway things that you feel like as parents that we can really focus on in helping to close that gap? And then also as physicians, as providers, in what they can also do in primary care in the community to close that gap, so that then we sort of in the middle sort of stand to be that support as much as we can.
Yeah, so I mean, I think again, parents have to see sleep as a priority. And so, scheduling and sort of creating a life that includes or mandates that, sleep is, and routine is very important in kids, so teaching kids those sleep habits from quite early, and modeling good sleep is I think quite important. I think that, just, I guess, becoming more knowledgeable about sleep-related issues, and having frank discussions with the primary care provider about that would be a good place to start. And, from a primary care provider perspective, I think that, there is a lot of, information or different types of screening tools that currently exist. But I think and it can start with simple steps. Just include a routine sleep screen, that covers both quality, quantity, daytime symptoms of poor quality sleep, questions about overnight wakings. Incorporate that into, the questions that are asked, and ask very directed questions. So not just, oh, how is your child sleep, right? Very directed questions. And so, I mean, I think for me, it is my hope that, there can be some sort of resource that, a primary care provider who, wants to learn more and wants to really sort of arm themselves with that knowledge, would have access to be more well-versed in the knowledge that wasn't sort of, given in medical school or in residency training, so that they can actually detect sleep issues and actually action them. Yeah.
That's great. So what I'm hearing, I'm taking away is one, it starts with a decision. That
Yes.
decision is to make sleep a priority as a parent, as a provider. That decision is critical because we know that it's not just a luxury. It's like I say, it's a fundamental biological need that we all have to take part in to live actually. And then number two, as a parent, is to advocate for your child. So if your child has any sleep issues, really listening in and pushing for something to be done. Because while there have been different studies that have looked at trajectories of sleep problems, there's some children that do get better. And most times when you go, sometimes you hear people say, oh, it's okay, just hang in there, it will get better, or they'll outgrow it. And then 5 years later, they're still coming into your room, fragmenting your sleep. Nobody's sleeping, everybody is cranky and angry. You're wondering what happened. So there's sometimes when it does go on for a sustained period of time. So
Yeah.
learning that advocacy, and also like you mentioned, I love, is adopting healthy sleep habits, even from the foundation, making sure that you have a routine, you're, making sure the environment is appropriate, taking away the devices. And we have tons of resources on Restful Sleep MD where you can also get all that information. But then on the flip side, on the doctor, and your doctor or your provider side, incorporate, like you mentioned, incorporating sleep questions in basic evaluations. It doesn't have to be like a whole full extensive thing, but even if it's like 2 or 3 critical questions, and there are tons of resources online. The second thing, as a doctor, as someone that cares for children, is making sure that you use the resources that are available. Again, the resources online, you may need to get that education. Even if you didn't get an extensive one, you can educate yourself enough to impact and help your patients significantly. And the American Academy of Sleep Medicine is a huge resource for patients, for clinicians and things, and there's so many other resources. But then there's an incredible also program and resource that's coming up, that Dr. Anya is really helping us facilitate, which I think is super exciting. So tell us a little bit about that.
Yeah, so my vision is to create a one-stop shop. So yes, there are many resources that exist that are very, very like amazing, and provide a lot of evidence for how to manage and treat sleep issues. But my vision is to have a one-stop shop for physicians, for primary care providers, so nurse practitioners, family doctors, pediatricians, that encompasses sleep issues and sleep conditions in the infant, in the preschooler, in the school age child, and in the adolescent. What those issues will look like, how to screen for them, and then what to do with that information. And so I'm, again, if even of the millions of kids that we have affected, if even 1% or 2% of the family doctors who see hundreds of kids took in that knowledge and was able to actually screen and identify issues and get kids the treatment that they need, I think it would be impactful enough, and my goal is really to impact sleep medicine and sleep health in children, and reduce the overall sort of morbidity and secondary health issues that arise from poor quality sleep. And so, I hope that it's in the works, and if you follow the sleep gap, you'll be updated with all the updates that we have. But that is really the goal. Yeah.
That's exciting. So how do we just get started to make sure we don't miss out? Because I know that there's so much, you have so much in store. So what are the next steps? What do you think folks should do? Follow you? What do you think?
So again, I'm still in the infancy. I'm a newborn. And so so the Sleep Gap is up and running. You can find it at the Sleep Gap on Instagram. I have a blog that I've started as well. Our website will be coming soon, and contact information and that sort of stuff will be up as well. And I plan to also start a newsletter. So I'll be collecting some emails and sending out weekly newsletters as well. So that's all exciting stuff in the work.
Oh, this is so exciting. So you heard her. So just go right on to follow Sleep Gap. There's already tons, there's blogs there, there's already some really, really cool posts. That's so educational, so critical, and I'm really excited. Also, if you're, if you have an infant or a child within the first year of life, another place you could start is there's a baby center 3-stage sleep solution, which I had the fortune of helping to produce, which also it's really empowering you as a mom on understanding sleep for your child. So you could find that on Restful Sleep MD. And so right on there, 2 people you need to have on your follow list, that's the Sleep Gap and Restful Sleep MD, because we are both on a mission to really foster helping people sleep better, to help empower primary care providers, to help empower moms, to help empower parents, to help their children sleep better. Because when our kids sleep better, we all sleep better. So this has been really exciting. Any final words, Dr. Anya? Anything else?
No, I'm very excited. Thanks for having me. And stay tuned. Hashtag stay tuned.
I know. Well, good to have you. And thanks, everyone. Take care and have a good evening.
Take care.
Bye.
Bye.